This is Chapter 7, Part 2. We were going over the different philosophies of punishment, of corrections, and we finished up last time talking a little bit about deterrence. The next one we have listed here is rehabilitation. Under this philosophy, the goal of corrections is very simple: to help individuals change the behavior that led to criminal justice involvement in the first place. So it's really tied in most closely to this term of corrections. Corrections implies that you've got bad behavior that needs to be corrected, that needs to be straightened out and turned into good behavior. And so definitely you can see that the rehabilitation approach is central to this idea of corrections. Um, you know, Contrast a therapeutic approach, a rehabilitation approach, with, say, deterrence or incapacitation. Those theories say that, they kind of assume that maybe it's difficult, maybe it's very hard, or in some cases maybe even impossible to change somebody's behavior, to change their personality, to change their makeup, to change them on the inside. And so what you do is you shape their behavior either through threats of punishment, the disincentives to commit crimes in the case of deterrence, or just sort of like the physical restraint of the individual. So even though they want to commit the crimes, they can't because they're restrained. Rehabilitation is changing the person, which, if you think about it, is kind of an ambitious goal, because it's not easy to change people. Changing people's behavior, that's not necessarily a simple thing. Recidivism, a couple of terms we need to just introduce here. I'm pretty sure all you folks are familiar with these terms, but just so we're on the same page, by recidivism, we're talking about reoffending, returning to committing crimes after a conviction. So falling back into crime after a conviction for a crime. The overarching goal of corrections is to reduce recidivism, which is not the simplest way to say to stop people from committing crimes in the future that they have been committing in the past. So, but we always have these sort of fancy technical terms. The body of research dealing with effective intervention principles can be summarized into three principles. Number one, the risk principle. Number two, the need principle. And number three, the responsivity principle. These principles are referred to as the R&R principles, referring to the components of risk, need, and responsivity. Okay, and I pulled this graph from the textbook to just give us a nice visual summarizing what these principles are about. So the risk principle, this is, in this case, they ask a question: who's supposed to be targeted against this as part of this principle? And the answer is those who are at higher risk for reoffending, limiting interventions for low-risk offenders. So this idea is that we assume that people are not all equally motivated to commit crimes. Some people are minor offenders with lower levels of motivation for crime. And then you have high-risk offenders who have a deeper, stronger, more persistent motivation to commit crimes. So the risk principle says that you should target individuals first and foremost who have the most serious risk, who are most likely to reoffend, recidivate. Your high-risk individuals. And you can think of it in terms of risk or probabilities. Say that over the next year, a low-risk person only has a 5% chance of reoffending, whereas the high-risk offender has a 75% chance of reoffending over the next year. See, so risk is another way of talking about what are the chances that it's going to happen over a given period of time. Some people high risk, some people medium risk, some people low risk. The need principle, what we mean by that is not like exactly who to target for intervention, but sort of like, what is it? Assume that we want to intervene with a person. What is it that we want to target? What is it that we want to try to work on? Needs. The needs principle says that you should target the needs that increase the likelihood of reoffense. So the idea behind this is, and we've got notes down below, but let me just say quickly here, the idea is that every human being has certain needs, has certain yeah, certain strong needs, and if those needs are not being met, then one might turn to criminal behavior as a way to an illegal way to get one's needs met. And I'll hold off on the list of things that have been found in research to be strongly correlated with reoffending, with committing crimes and committing them again, and it would be true for drug abuse as well. We'll get to that. Finally, the responsivity principle is how to target. So it's a little more detailed, a little more nuanced, which is it's the idea that you have general approaches. The research may point to this particular thing as generally or being effective or tending to be effective with people. But when you research is based on what works overall, what tend to work for a group, a sample of people who've been studied. And so it really applies to groups, but individuals vary. So it might work for the majority, but it may not work for the minority, or it may work stronger for some, but only work weakly and not as effectively for others. So individuals vary. That's the idea here. Not everybody in the group is the same. Some people are going to respond better to treatment, better than others, hence the responsivity principle. Again, we'll talk about this a little more here in just a second as we get to these specific points. So the risk principle focuses on the risk potential of an individual who is targeted for a particular correctional intervention. That's kind of a mouthful, fancy language for saying, well, who are we going to, for example, who are we going to lock up? Do we lock up everybody, minor offenders as well as serious offenders, or what? Where are we going to draw the line? So we could use risk, the chances of reoffending, as a help to guide us towards, who we're going to lock up and who we aren't. Or you could focus on some other intervention too, not just incarceration. This principle argues that the intensity of the intervention should be commensurate with an offender's risk for criminal recidivism. So the higher the risk the person is of committing crimes again in the future, recidivating, the greater need or the greater justification for more intensive interventions like incarceration. If someone is a serious violent criminal, there's somebody who always goes back to their crimes, always goes back repeatedly again and again, well, that's a person, according to this risk principle, who would be first to get locked up. Not last, but first, because they're the highest risk. Next point. Validated risk assessment. What we mean by these examine the range of risk factors that can help predict the individual who's most likely to reoffend. So there's this school of thought in criminal justice that we can measure a person's risk. We can come up with they'll call it an inventory or assessment that goes through and looks at several different factors which have been shown through prior research, again, looking at groups of people, samples of people, what tends to best predict that somebody recidivates, that they fall back into crime. And then you come up with a list of those things that most strongly predict reoffending. Then you do this assessment where you find out how this person that you're focusing on, how they are on these different risks. And then you add it all up and you find out, okay, is this person high risk, medium risk, low risk, based on their situation, their personality characteristics, who they are, what their situation is, to determine whether what their level of risk is. So it's kind of this empirical, scientific, if you want to call it, quantitative approach to trying to estimate the chance of this person getting into trouble again, and then planning what you're going to do with this individual based on this assessment, based on this prediction is what it is of how likely they are to keep committing crimes in the future. Validated risk assessment. Validated means it's been checked out by research. It's been shown to be effective and to have some validity, meaning truthfulness, based on prior research. So it's not just something somebody dreams up. It's based on data. Okay, offenders who are administered a risk assessment are often classified based on their probability of reoffense. So again, we give you this test, this assessment, ask you all these questions, look at your background, gather data on you, and see, add up all those different factors and find out what's your level of risk: high risk, medium risk, low risk. And risk of what? Of reoffending, right? So this classification of offenders is something that's used commonly in the criminal justice system. Research on the effectiveness of exposing low-risk offenders to intensive supervision and treatment services has shown mixed results. So the textbook's a little stronger here than what I'm saying. The textbook says that, according to the research, that you really shouldn't go tough on low-risk offenders because you run the risk. There's the chance that if, say, for example, you lock up a teenager who hasn't done really serious crimes, and you do a risk assessment on them, and the risk assessment says, well, they're pretty low risk for doing crimes again in the future. According to the textbook, if you were to lock up that kid, you might make things worse, because you expose them to other, maybe more hardcore offenders, where they're going to learn bad behaviors, have bad examples, be surrounded by bad examples, that they'll be hardened by getting locked up, because that's a real tough way to go, and it's not going to be good for the child, is what the textbook is saying. So that what the textbook's saying is that that you probably shouldn't get tough on teenagers, or not just teenagers, but low risk offenders is really what they're saying, because it can make things worse. I've looked at a lot of research, and I would say it's more mixed than that. It's really unclear whether it makes things worse, or doesn't make a difference, or make things better to get tough with these low risk offenders. For example, you see research that'll say, if you have a low risk offender, let's say like it's a teenager, a first time offender, that I've seen research concluding that that if you're really tough on them the first time, or early on, that they seem to be low risk, and you're tough on them, that really scares them, that the system is like, you don't want to go there because it's not worth it. And so it's sort of a shock to the individual, and so it's effective in keeping them away from further crime. So I've seen studies go that way, and I've seen studies that say, no, it actually makes the kids worse. And then I've seen studies that say it doesn't make a difference. So, that's more unclear, based on, I think I'm looking at a lot more research than what the textbook is looking at. So I would say the picture is not as clear as the textbook is saying. Let's see. Some studies suggest that these services can reduce recidivism rates, while others have found no significant impact or even an increase in reoffending. So you got stuff all over the place. You got stuff all over the research, all over the place, findings all over the place. You don't know what to make of it. It's unfortunate that we don't have clear results. I think that's one of the most frustrating things about criminology, is a lot of times the results, the findings are not clear. And so we got to have better research so we can figure out what the heck's going on and what works and what doesn't. Next page here. According to the need principle, the focus should be on what needs a program is targeting. Some needs are what we call criminogenic. What does that mean? Well, let's break it apart. One way to figure out what words mean is break them into their parts. Crim, obviously that means crime. Genic on the end means like generating, making. So criminogenic needs are crime-making needs that contribute to criminal behavior. So other needs are non-criminogenic. So I've got here examples. Well, let's divide it up into two first. So if you're a little confused by exactly what we mean by criminogenic, hold on for a second. Dynamic risk factors, those describe the needs that put an individual at risk for reoffending, number one, and number two are the kind of things that maybe we can change, that maybe are changeable. Right? Dynamic risk factors. That's in contrast to static risk factors that a lot of our research, I think, kind of not very is not very practical, that focuses on, say, what we call demographic factors: age, gender, race, ethnicity. There's a lot of studies that focus on that stuff, but those are things that you can't, generally speaking, overall, you can't change those things. Age, you can't wave a magic wand and make some some person young, old enough that they are not going to commit crime so much anymore, because we know that as people age, they tend to slow down and commit fewer crimes. But age is not something you can change. You have to wait for somebody to get old. And so these demographic variables, they get studied a lot, but they're not practical. This is because of stuff we can't change. But there are things we can change, and those are the dynamic risk factors. And that's, of course, what we need to be focused on if our goal is to reduce recidivism, reduce crime, reduce drug abuse, drug crimes. Now, the textbook lists criminogenic needs, but I think before I get into those, it's kind of a long list. We've again hit this mark where I like to take a break. We'll continue on in part 3.